Hi, everyone. Good morning.
Good morning.
Hi. Good morning, everyone. Welcome. Okay, we're just going to get started. My name is Laura, last name Kluss. I am a licensed clinical social worker with the VA in Palo Alto, and I am a suicide prevention coordinator. And Dr. Karen Fowler is here as well. Dr. Fowler is a psychologist and our team lead for the suicide prevention team with Palo Alto. We are here today to talk about lethal means and what that means and how to help our veterans. And we're just going to talk about suicide prevention in general when it comes to lethal means counseling and firearms. So I'm going to go ahead and share my screen. Can you give me a thumbs up if you can see my screen? Rich, thumbs up? Yeah, okay. So, okay, there we go. All right, I'm gonna go into presenter mode. Here we go. Okay, so lethal means safety. Again, I'm Laura, Dr. Fowler is here as well. I've cited some of our sources today that we've used to present this information. Okay, before we begin, I just want to tell everyone that we understand that suicide is an intense topic. If you want to step away, feel free. If you need to exit, that's okay. We know that this is a challenging topic to discuss. We have included the information for our suicide hotline. This is applicable to not just veterans, but anyone in general can go to 988 for help with a crisis. I apologize, I probably have allergies, so excuse me a little bit. And I'm gonna sneeze, hopefully not. Okay, so today our objectives, we wanna look to define lethal means safety, understand what that means, especially when it comes to veteran death by suicide. We're gonna increase our understanding of firearms and the veteran population, and how to talk about lethal means access and storage with our vets. Also, I wanna say that today a lot of what we discuss doesn't have to just be applicable to veterans. It can be helpful for everyone. Okay, so lethal means are objects like medications, firearms, sharp instruments that can be used to inflict self-directed violence. Lethal means safety, or LMS, is an intentional voluntary practice to reduce one's suicide risk by limiting access to those lethal means. We have some helpful links here. I do want to say that there will be quite a bit of information available throughout this presentation, which everyone will have access to afterward. So don't worry about clicking on all these links and saving them. We'll make sure you get this. Okay, why is lethal means important? Why is safety important? Because we know that if we increase the time and distance between someone with suicidal intent and lethal means, this can reduce suicide risk. So increasing the time and the space between someone and something that's lethal. So people who attempted suicide in general, this is a study that we are aware of. People who attempted suicide were asked how long before a suicide event that they first thought about making an attempt. So what is the duration of time? So we see here that almost 50%, it took less than 10 minutes for their suicide act. You can kind of look here. So maybe 2 or 3 or 4% took 11 to 30 minutes and so on. But we know that there are lots of people who, just under 50% who took an action on suicidal thoughts within under 10 minutes. So here it is. Sorry, I forgot I had this part. So 48% said 10 minutes or less. Most people who become suicidal have struggled with ongoing underlying problems, but the movement from suicide and suicide A suicidal idea to attempt can be pretty rapid. So the duration of a crisis, people who nearly died in an attempt were asked the interval between deciding to attempt suicide and attempting. 24% said it was less than 5 minutes. 47% said an hour or less. 16% less than a day. 13% said a day or more. So we know that the acute phase of suicidal crisis is brief. Acute meaning dangerous at its most intense. That time is brief. So in firearm use, when a firearm is used, 85 to 90% of the time it's fatal. If something other than a firearm is used, 5% of those are fatal. But again, if a firearm is used, 85 to 90% are going to be deadly. So again, just a reminder, lethal means are objects that can be used by individuals experiencing a crisis. They include things like guns, medications, alcohol, opioids, other substances, ropes, cords, or sharp objects. If a veteran is in crisis or having suicidal thoughts, these items can become deadly. Increasing the time and distance between a person in a crisis and their access to lethal means can reduce suicide risk and save lives. So we have a program called Keep It Secure, which promotes awareness about the simple steps you can take to protect yourself and your family. And we know that nearly 7 out of every 10 veteran deaths by suicide are the result of firearm injuries. I do want to note that a lot of the statistics we will talk about today are from the most recent reporting, which is 2021. We are eagerly awaiting. I think our new report should be out soon, but we haven't seen it yet, so a lot of the information is from 2021. Okay, so looking at veterans versus non-veterans. Firearms for veterans are used 72% of the time. Out of suicide methods, 72% are using firearms. Poisoning, 7.8%. Suffocation, that could generally means hanging. That's 14.9%, 5.2 is any other means. You can see it's less with non-veteran adults. So it's higher with suffocation, as you can see here, but firearms is significantly less than, I'm sorry, it's 52% for the non-veteran population. Okay, here's another graphic that we thought was helpful. So firearm suicide rate among veteran men was 62.4% higher than for non-veteran men in 2021. 72% of veteran suicides were by firearm in 2021. Veteran firearm suicides from 2001 to 2021 increased by 5.7%. Firearm ownership is more prevalent among vets than non-veterans. That's a pretty significant difference there. 1 in 3 vet firearm owners store at least one firearm unlocked and loaded. Firearm suicide rate among veteran women was 281.1% higher than non-veteran women in 2021. There was a 14% increase in veteran women firearm suicide deaths from 2001 to 2021. So here's kind of a repetition of that in detail. In each year among veterans, firearm and suffocation suicide mortality rates were higher for men than for women, while poisoning suicide mortality rates were lower for men than for women. In 2021, firearm suicide rate 190.1% higher for veteran men than for veteran women. Suffocation suicide rates 50.9% higher for veteran men than for veteran women. Poisoning suicide 40.4% lower for veteran men than for veteran women. In each year, 2001 to 2021, firearm and poisoning suicide mortality rates were higher and suffocation mortality rates were lower for vet men than for non-veteran men. 2021, firearm suicide rates 62.4% higher for veteran men than for non-veteran men. Poisoning rate 14.3% higher for veteran men than for non-veteran men. Suffocation suicide rate, 31.3% lower for veteran men than for non-veteran men. And our last slide like this, in each year, 2001 to 2021, firearm suicide mortality and poisoning suicide mortality rates were higher for veteran women than for non-veteran women. 2021 firearm suicide rate, like I said, 281% higher. Poisoning rates, 110.1% higher for veteran women than non-veteran women. Suffocation suicide rate in 2021 was 88% higher for veteran women than for non-veteran women. Here's another graphic that just shows how prevalent firearm suicide rates are. From 2001 to 2021, this clearly shows the prevalence of firearms. Then you have poisoning is next. Well, suffocation is right there as well. Okay, so what can we do? That's what we really want to talk about. What can we do? So we want to talk to people about suicide. In this presentation, we are going to focus on, this topic. So I wanted to just touch on this, although we won't go into lots of depth about how to talk about suicide, but I did want to touch on it. So of course we want to ask the person, are you feeling suicidal or are you thinking about suicide? There's a misconception that this is not an okay question to ask, or that asking this question could push someone further, but that is not the case. Studies have shown, and healthcare professionals are trained that this is appropriate. It gives the person an opportunity to maybe talk about how they're feeling. So are you feeling suicidal? Are you thinking about it? Even if the person says no, it's okay to discuss safe storage with the individual. So one phrase that I heard a lot over the summer when I went to a suicide prevention conference is to talk about storing a firearm, that it is voluntary and temporary. So we don't have to be initiating the conversation by talking really, firmly and permanently about removing guns. We can talk about it being voluntary and temporary. The veteran can learn about the options. The person can talk about their options for safe storage, and that it's temporary while that person is going through a crisis, or while their mental health isn't very, very good. We can safely remove the firearms temporarily while they are getting help. We want to be mindful when speaking with veterans about the firearms, knowing that they were trained to use firearms, and we just want to be mindful that we are gentle, that we keep the conversation open-ended. We're not telling them that something's bad or good. We're letting them talk about how the firearm might be unsafe or risky to have around while the person isn't doing well. But we just want to remember that these are typically individuals who know a lot about firearms and potentially use them quite a bit during their military experience. Okay, so again, when you're having the conversation, you want to emphasize temporary and flexible nature of what you're proposing. So the goal is not to have every vet store firearms out of the home forever. When you talk about the firearm and removing it, you can use analogies. For example, we know that people have attempted suicide at the Golden Gate Bridge. Maybe someone who lives in the area knows that they easily can go there, right? We know that they are, maybe they talk about having thoughts of jumping off a bridge. And so if that is the case, we would encourage someone to take the BART, to carpool with someone else. Basically, we want to encourage them not to go to the Golden Gate Bridge. Let's talk about other ways you can get to work. You're basically talking to them about not, exposing yourself to that thing that you're saying is the means that you might attempt suicide, right? So we're going to help someone come up with alternative transportation, commute strategy to avoid the Golden Gate Bridge. Similarly, drinking and driving, you can talk to them about, hey, when you do have those drinks, let's talk about how else you're going to get home safely. We're going to help them avoid taking the keys and getting into a vehicle because it's risky, right? So you can use those analogies when you're talking to someone about the rationale of removing the firearm, even if it's temporarily, getting it further away. Okay, so remember you have storage options with firearms. So temporarily storing guns away from a home, that's an option. Locking the firearm and giving someone the key, or storing a key in a bank safe deposit box, someone else's safety deposit box. Asking someone to change the combination. So that other person that you can trust, they may change the combination, but the veteran is not going to know the combination. You can temporarily disable the gun, like giving a component of the gun, like the firing pin, to someone else. And storing ammunition outside the home that isn't accessible. So it's really about access and reducing, limiting, or removing the access altogether. If other options are not possible, just know a locked gun poses a lower suicide risk than an unlocked gun, no matter who holds the key. So you can use cable locks, trigger locks, and safes. An unloaded gun, where ammunition is stored separately, poses a lower risk than a loaded gun. So let's say the veteran, in maybe your first conversation, is going to refuse, having someone else store the weapon. So you can talk to them about making the gun less risky, like having it unloaded and locked somewhere. And we don't recommend hiding guns. That can pose other risks. Someone inadvertently finding it that shouldn't. And it just can create this kind of secrecy and uncertainty of what the real status is of the firearm. Remember that these steps can increase time and distance between the impulse of suicide, and it can reduce your risk overall. So storing your firearm off-site, perhaps relatives, provided they aren't prohibited from possessing firearms, and you can have a short-term loan. We do want to say that, of course, with any of these options, you would want to just check the laws in your area, in your county, legally, make sure that someone else storing it is allowed to also have the firearm in their possession. Does the person's name need to be on that permit? So just make sure that those things are checked as far as having a friend or family store the firearm. You want to check on the legality side of all that. A storage facility might be able to store the firearm. Of course, ammunition would be stored separately. Some police departments will store temporarily at no charge. Check with your local police department. Most PDs offer disposal service if person no longer wants their gun. Pawn shop, pawning the gun for a very small loan amount is a reliable storage option with interest fees. Or gun stores or gun clubs, some may offer free or inexpensive storage options. Transport guns, be careful that you are transport guns unloaded in a locked box. So you want to make sure it's moved in a locked box. Okay, so again, we will provide these links afterward, but this is a program through the VA, keepitsecure.net. So this is a place that you can learn more about storing firearms. And I want to share this video. I hope this will open for me. Oopsie, here we go. So this is a website from the VA. I wanted to share this, keepitsecure.net. I wanted to share this sort of PSA commercial, you could call it.
Hey, you made it. Come on in.
Are you sick of hollow gestures and meaningless nods of understanding?
I know you've been through.
Are you tired of being repeatedly thanked and told you're a hero, while you feel like a liability?
Thank you for your service.
Crisis can happen unexpectedly to anyone. And though it may seem like a small barrier, a simple lock puts space between the thought and the trigger. Learn how securing your guns can help prevent suicide.
So we wanted to show you some examples. The VA, we do have a program that provides veterans with gun locks, but I just wanted to demonstrate for the community that these are pretty accessible. So this is from Amazon. Just to show you, you can just search gun lock, and you have different cable lock options that are very affordable. So it is not a bad idea, depending on who you work with, who you work for, or even for your own personal safety, to know that you can easily obtain gun locks, cable gun locks, again, on Amazon. I'm sure lots of places will have them, but we just wanted to bring your attention that they are very accessible. Okay, so we talked a lot about firearm safety. I wanted to also just touch on some other lethal means and how to manage those. So we have veterans and individuals who might talk about taking all their medications at once. People have all different sort of medications prescribed. Of course, there are all the other sort of drugs and medications that people may get without the prescription. So here are some thoughts. So for many vets and their families, taking meds are necessary and part of leading a healthy life. But like guns, medications should be securely stowed when not in use. So tips for preventing intentional or unintentional overdose: keep meds secured and out of a child's sight and reach. Have a family member or friend help manage your medication dosages. Portion your pills out for the week, then lock the rest away. Secure any sedatives, stimulants, or opioid meds in a locked location. Proactively ask your doctor or pharmacist to limit the number of refills or quantity of medication, or request a blister pack. Blister packs are those little like plastic packages where you have to push out to pop out the individual pill, which of course slows someone down, right? You can't just dump the whole bottle of pills in your hand at once. But that is something to remember, to talk to your doctor if you're concerned for your own safety or someone else's that maybe you help with their healthcare appointments, but to talk to your prescriber about how to limit the medications available. And then dispose of any medication past its expiration date, unused within the last 12 months, or no longer needed. Okay, let's talk about the suffocation safety measures. So in healthcare, we use this term quite a bit, especially if you're in a hospital or inpatient setting. But note, so if someone has a history or has ideations about hanging, you want to pay attention to ligature and ligature point. So ligature is any item that can be used for hanging: a rope, belt, cord, scarves, cables, sheets. And then a ligature point is anything that could be used to attach a ligature. So door frame, doorknobs, shower rails, ceiling fittings, coat hooks, and pipes. So we understand that it would, there are certain things that are difficult to retrofit, especially in someone's home. But this is something to be thoughtful of if a person has thoughts about hanging. So reducing access to ligatures could mean throwing them away, cutting them, securing them in locked containers, or moving them to a location away from the home. Consider assessing access to or ideation about ligatures as part of suicide safety planning. It is not feasible to reduce access to all potential ligatures and ligature points in someone's environment. It is not feasible or advisable to review all potential ligatures and ligature points in someone's environment. Focus on items someone is ideating about or recently acquired. So ideation, if there's something that you're aware of that someone is, whether they're looking at it a lot, they're talking about it, those are what we can kind of work to control. With the veteran's permission, consider involving family, friends, or other persons concerned in these discussions, and educate them on recognizing warning signs. Okay, we wanted to just bring to your attention that there is an app available for anyone, not just veterans, anyone on your phone. You are welcome to scan this QR code. I hope it would work on this. If not, let us know. But there is a safety plan app that anyone can put on their phone who might be experiencing suicidal thoughts. You can basically create a personalized step-by-step action plan to recognize and cope with suicidal thoughts. They will input their reasons for living, their coping tools that they know they have, self-assessment measurements, crisis resources are on there. So we do encourage you to put this app on your phone. Maybe you can, just explore it, learn how it works. That way you can help educate others that you might be concerned about. On how it's used, why it's used. This is going to be used when someone recognizes that they are feeling some warning signs that maybe a crisis is coming up or they're starting to feel unsafe. This app will just give them the reminders and the tools, whether it's deep breathing or turning on their music, reminding them of who to call when they're not feeling well, so a safety contact. But we really recommend checking this app out. Here we have a variety of resources. Like I said, we can provide these after the presentation. And there's all different things here. That's the end of the presentation. So we wanted to make sure we have time. Let me just double check. Yeah, so that we have time for questions, comments. I have not even looked at the chat. So maybe Dr. Fowler, I don't know if you want to come on mic. And we encourage everyone to, I don't know if you want to raise your hand or just jump in. And I don't even know what time it is. So feel free to chime in with questions, comments. Looks like the QR code may not be working. We'll work on that. Okay, please feel free to come on camera or unmute if you would like to chat or ask a question.
Yes. And for the person who was asking about sharing the slides, the slides will be shared. So all the resources you will have access to at the end of this presentation.
I can't find where to raise my hand, but anyway, just clarifying, the 988 is also for non-veterans, is that right?
Yes, so with 988, that's for everyone. That will go to the crisis hotline. But 988, once it's dialed or texted, it will prompt if you're a veteran to press 1, and pressing 1 will get the veteran sort of allocated to specialty assessment, and then that ends up getting to the VA, to us as a team, suicide prevention coordinators. But yes, 988 is for everyone.
Thank you.
Thank you.
And
Good question.
I wanted to also share another resource. So we at the VA have a MyRec 19 consultation program. So they provide a free consultation to any provider working with a veteran in the VA or outside of the VA. It's a de-identified consultation. It's free of charge. It's not a crisis line, so you wouldn't contact them if you have somebody who's in crisis, but you could schedule a consultation and they can set up the time for you. And I will go ahead and paste that website.
Great.
Okay, and this is Chris. Yeah, I wanted to ask. So I mentioned earlier, and I know it's responded to about I was volunteering on 988 and I got a veteran. They kept referencing the Veterans Crisis Line. I didn't know what that was, so I asked my supervisor. My supervisor didn't know what it was. So there definitely, it sounds like, needs to be a lot more education about its existence. And I'm wondering if it's newer or why people don't know.
When may I ask when this was?
Yeah, this would have been about 2 years ago, maybe a year or so. Well, I
Okay,
think year actually.
sure. Dr. Fowler, do we know when it formally became the Veterans Crisis Line, or when that was rolled out?
Yeah, so the crisis line, the Veteran Military Crisis Line, it was established, I think, in 2001. And since then, it has really grown. So right now, we have 3 call centers. One is in Canandaigua, New York, one is in Topeka, Kansas, and one is in Atlanta, Georgia. So what happens is that anybody can call the 988. That's the national lifeline, the suicide prevention lifeline. But if you're calling directly to the veteran crisis line, as Laura mentioned, you would press 1 and you would be sent to the call center. In terms of the 988 rollout, that happened in July of last year. But it's not a new crisis line. It's the same number. So before it was the 273 2855. 1-800-273-2855. That was the number. Now it's a 3-digit call number, 988. But the original crisis line is still there. So anybody can call the longer number and still get to the same spot. So in terms of kind of the lack of people knowing about it, that's really good information for us, because that's definitely something we want to put out there, the number 988, press 1. It's just, so please share it with your contacts. Please share it with your circles, with the community at large. So we definitely want people to know about this resource.
And
And the suicide prevention, oh, go ahead, Christina.
yeah, I was just gonna say, I have a follow-up question that so before 988 there was the other number, was a 1-800 number. How long had that been in effect? They call that and press 1 for the veterans crisis.
So yeah,
2001?
sorry, as I mentioned, the 1-800-273-255, that was established in 2007. So, and then the 988 was rolled out last July. So the Veteran Military Crisis Line is since 2007. And I will actually segue into a different question that I just mentioned that's related about who can call the crisis line. That's actually a really good question. So anyone can call the veteran crisis line. We get veterans calling who are not eligible for VA services. That's in fact one of a common questions we get from the crisis line, is that what am I eligible for, or I'm not eligible, but I'm in crisis. So they can still call the crisis line. I won't go into too much detail about veteran eligibility because that's a really complicated topic, but I'll say that sometimes people who were not eligible in the past are eligible now. We have the PACT Act, we have the Compact Act now, where the eligibility is expanded. And also veterans can be eligible for some things and not others. So really, I wouldn't discourage people calling, even if they feel like they don't have eligibility. So any veteran can call it. We also have caregivers, family members calling the crisis line. We get a lot of third-party calls to the crisis line, so they can also do so. The process is then, if somebody, a third party calls the crisis line, then the crisis line responder will get information from the third party and they will then reach out to the veteran. So I hope that answers your question.
And just to kind of go back on visibility. Our suicide prevention coordinators, we also do outreach in the community similar to today. So we will always make sure we're distributing information about 988. We have all different sorts of swag. So let us know if there's any additional requests for outreach, but we like to be out there just to make sure that people are hearing about the Veterans Crisis Line and what's available.
Mhm. And I do see another question about eligibility from Jackie in terms of the other than honorable veterans. So I guess, again, kind of similarly, is that veteran eligibility is very complicated. If somebody has a bad discharge in OTH or they didn't serve enough in the military, that in itself may or may not preclude them from receiving VA healthcare. So what I would encourage you to let the veteran know is that, one, if it's an imminent crisis, they should always come to an emergency room. And if it's the VA emergency room, even if they're not eligible, the VA emergency room will take them, they will assess them, and they will check their eligibility. They will treat them on a humanitarian basis if it's a crisis. If they need admission, they may partner with community agencies or hospitals, but definitely eligibility should not be the concern if somebody's in crisis. And again, with the PACT Act, if a veteran's in crisis, they may be eligible for example, an inpatient stay or an outpatient treatment post that crisis if they meet PACT eligibility. If they're not in crisis, what I recommend them doing is they should still come to their nearest business office at the VA. So depending on where they're located, they can always look up their closest business office, and then they can review their eligibility and see what the options are. The last thing I'll say about eligibility is that if you have a veteran who is either a combat veteran or has history of military sexual trauma, another option would be to refer them to their nearest vet centers. So vet centers are separate from the VA. They only treat veterans who have either military sexual trauma or combat. So for that, they may be eligible even if they have a discharge that's like an OTH or something like that. They could be eligible for that service.
Other than honorable, just to clarify. Yeah. Okay, what is that center called? The vet center. The vet
Yes.
center.
Here, I will paste the link. This is a really, really good link. It's all the VA resources. So you can look at this link, and you can type in your zip code, and you could check which service you're looking for.
Dr. Fowler, there's a question about MyRec. Is this for California only or nationwide, the consult?
Nationwide.
Nationwide for the consult with MyRec. Okay, and then just a reminder, it looks like that QR code wasn't active. And someone did say if you go to the app store in your phone and look it up, safety plan, it will come up and you can download it that way.
Yes. And I did also paste the link to mobile apps.
Awesome. Okay. Okay, any other questions or discussion points? Christina?
Yeah, I just wanted to mention that I was actually working when I was signing for independent living, working with a individual who said they had veteran status and they weren't able to get a lot of services where they were living at the facility that they could get at the VA. The VA was able to help them with a lot of things they weren't able to access otherwise. So that's great that you put that link in there, Karen. That's all.
Very good. That's good to hear. So just wanted to, remind everyone, 988, anyone can call 988, press 1 if it's a veteran, or if you're a third party, you can call as a third party. So if you have concerns about someone, veteran or not, third party calls are welcome. And the ultimate goal is that the person will get resources available. Of course, we have ways to get emergency help in case of immediate crisis. And we will send out the slides. Anything else? One thing we say at the VA as healthcare providers, but as VA employees, is that suicide is everyone's business. So we encourage everyone to maybe review the slides, let us know if you have other questions, but that we all have the ability to help someone who's maybe going through a mental health crisis, and talking about these things can help make it easier, I think, to feel comfortable having the discussion, and that we have all those resources available, and we appreciate everyone that joined us today, and thank you for inviting us.